Alright, let's begin our discussion of what are artifacts. So artifacts are simply reflections that are not real. Sometimes they're not even seen on the image. They are incorrect shape or size and in the incorrect position or incorrect brightness. What causes an artifact is the violation of the standard assumptions that the equipment must make. All other causes of artifacts can be simply the equipment malfunctioning. There are physical principles such as refraction that we've already discussed that can cause artifacts. And the most common is often operator error. So let's look at our basic assumptions of the machine. And so every ultrasound machine assumes that sound travels in a straight line. It assumes that sound travels directly to a reflector and the echo travels directly back. The machine assumes that the sound is traveling at exactly 1540 meters per second. It assumes that reflections only arise from structures positioned along the main axis of the beam. It makes an assumption that the imaging plane is very thin. And it makes the assumption that the strength of the reflection is related to the characteristics of the tissue which created the reflection. So, anytime these assumptions are not followed, then an artifact can appear. Most artifacts can usually be explained by determining which of these assumptions was violated. It's not always necessary, but it can be useful. The actual anatomy will always remain visible if you change the window or orientation. Artifacts will not remain visible necessarily if you change the window or the orientation of the probe. Instrument malfunctions which appear are going to appear as very obvious artifacts, and these won't resolve no matter how you move your probe. In these situations, you can only resolve them by contacting a service engineer or replacing the equipment. Let's talk about the first and most common artifact that we run into, and this is reverberation. Reverberation is a type of what we call multipath artifact, in that you will get multiple equally spaced echoes from sound that's bouncing between two strong reflectors. And so the characteristics of this is that you get multiples of this artifact. They appear equally spaced. They're located parallel to the main axis of the sound beam. They occur at ever increasing depths, and they fade as they get deeper. It violates the assumption, number 2, that sound travels directly to a reflector and back. So let's take a quick look at how this reflector is occurring. So if we look at this image on our screen here, and let's see if this is going to work. If the sound travels to this one strong reflector here and then bounces back to the transducer and then bounces back, and soon the sound is bouncing back and forth like this all the way across. Well, each time it comes back up to the transducer, it produces another reflection in our reverberation. So it comes back, goes back up to the transducer, and so we end up with these series of parallel reflections as the sound bounces back and forth between this very strong reflector here and the transducer at the top, and we get this strong reverberation artifact. A comet tail artifact is again another type of multipath artifact, a little different though. This is a ring down artifact, and this can be thought of as a reverberation artifact with all of the space between the lines squeezed out. Typically this arises from gas bubbles that are trapped in the path of the sound. Anything that can resonate that's trapped in the path, metal structures such as a BB. When children get shot with BBs, you'll see the comet tail artifact. And any kind of structure that vibrates will cause a comet tail artifact. And so what is happening in the comet tail artifact is, again, we're seeing a object, but in this case the object is vibrating back and forth when the sound hits it, and those vibrations cause the constant comet tail type artifact to be emitted from that object that's vibrating, whether the object is a gas bubble or a surgical staple or a BB or something like that. The object is vibrating and we get the comet tail behind it. So we have comet tail and ring down artifacts. These are both types of the same type of artifact. And here we see the cause of the ring down artifact. And ring down is usually specific to gas bubbles that are vibrating. When gas forms a tetrahedron in a mass of bubbles, so here we can see that tetrahedron in this picture, this is a particular structure that will then vibrate by the sound hitting the outer bubbles and causing this to vibrate back and forth, and it results in this ring down artifact that we see at the edge of this diaphragm. So there's little gas bubbles trapped along the edge of the diaphragm here, and these are causing ring down artifacts, and these are also known as B-lines, and those will become important when we start talking about how ultrasound can diagnose lung diseases such as COVID. So that's a ring down artifact that has occurred due to gas trapped in a tetrahedral structure, such as what you see in this image on the left. Shadowing is a very common artifact, and shadowing is a hypoechoic region posterior to a high attenuator, which is to say that things that attenuate greatly will cause shadows. Shadows always appear the same as the background color. So if you use a white background color, you get a white shadow. Okay. If you use a black background color, you get a black shadow. This is the result of too much attenuation. There's simply no more signal available, and so we see shadowing. And this prevents visualization of the true anatomy. So anything in the posterior to these gallstones, there could be a structure there. In fact, you know, if you saw a big old tumor in there, you wouldn't see the big old tumor in there because it's in the shadow of the gallstones. So these can prevent visualization of true anatomy. However, they do provide very important diagnostic information that you may need to characterize the tissue. And as an example of that, we know that these are gallstones partially because they shadow. Okay, if they're not shadowing, then they're not going to be called gallstones, right? So we have to be careful that our machine is set up correctly to allow for shadowing to occur. There's this particular type of shadow known as an edge shadow or critical angle shadow it can be caused by refraction. This is a hypoechoic region at the curved edge of a curved structure. So we see a shadowing in this area down here due to the curvature of the fetal skull. and this causes a refraction artifact, what we call a critical angle artifact, and we see this shadowing that occurs in the structures posterior to that. And this again violates the assumption that sound travels directly to a reflector and back. It gets to the reflector, that's for darn sure, but it doesn't come back because it bends off and goes into Never Never Land. Enhancement is kind of the opposite of shadowing, and this is where you see a hyperechoic region below or deep to tissues. This is caused by too little attenuation. So if the sound is not attenuated, such as through this cystic structure we see here, that is mostly fluid filled, and so there's no attenuation, and the echoes beyond it are amplified just as if there was attenuation, and so we get a brighter tissue posterior to the cystic lesion. This enhancement can often provide important diagnostic criteria needed to make a diagnosis, such as, hey, this is a cyst. We know it's a cyst because it creates enhancement. If it was just a dark mass, it probably wouldn't create enhancement. Dark masses don't enhance the tissues, cysts do. So this violates the assumption that the strength of a reflection is related to the characteristics of the tissue creating the reflection. Focal banding is a type of enhancement that generally is seen at within the focal zone. So it's an area, as you know, the intensity at the focus is greater than any other place along the beam path, and so because of the increased intensity at the focus, we see brighter echoes returning from the focus. In some situations, this intensity can be caused by a machine malfunction, so you have to look at this. There's a type of specific type of error with annular array transducers that is called banding, where instead of an enhancement band, it's a shadowing band that occurs when one of this annular array transducer crystals breaks. But since nobody uses annular array transducer crystals, I hope there's never a question on the SPI exam about that, because that's a stupid thing to ask when nobody's used that in at least 30 years. Mirror image artifacts are another type of multi-path artifact. The sound travels to a strong reflector and then strikes another reflector, and this causes the second copy of the reflection to appear. We know that the mirrored image artifacts exist in that they're always located along a straight line between the transducer and the artifact, or the reflector. That should say the reflector. Not sure it's letting me change this. So it's always along a straight line between the transducer and the reflector. It violates the assumption that the sound travels in a straight line and travels directly to a reflector and back. So when we look at this picture, I know what I need to do. Here we go. Nope, still not letting me fix that. Okay. So if we look at this picture, we can see that where this lesion is within the liver here, this is seen perfect when the sound travels directly to it and then comes back. Okay, so then along these scan lines, this lesion is placed correctly. But along some other scan lines, unfortunately, what happens is the sound comes down, hits the diaphragm, comes over and hits this lesion, and then bounces off, hits the diaphragm again, and comes back up to the transducer. causing the lesion to appear in the deep to the reflector, which is the diaphragm. And so we have this reflector kind of mirrored in a different location, and there's always a very strong reflector along the path between the mirrored image and the actual image, and in this case it's the diaphragm. We often see this with Doppler also. If you're looking at a subclavian artery in the chest, behind it is a strong reflector, the lung, and so you can actually get a reflection of the subclavian artery, and you can put your Doppler in there and you'll get a Doppler signal back and everything else. The mirror image has all the characteristics of the actual image, and so it's real. It's a real thing. So mirror images are the characteristics of a mirrored artifact is that it's a second copy of a true reflector, and often we can see that true reflector on the same image, so sometimes not. The artifact is always deeper than the real structure, and there's always a strong reflector between the artifact and the transducer. The true structure in the artifact are equal distance from the mirror. So if we go back to that picture real quick, we see that the reflector here, the diaphragm, the mirrored image is the exact same distance from the diaphragm on both the real and the reflected side. Spectral crosstalk is a unique type of artifact. Dr. Edelman calls it a mirror imaging artifact. He's the only person on earth that calls it a mirror imaging artifact. And it's not, because the spectrum is not an image, it's a display velocity that counts using the fast Fourier transformation. What it is caused by is overgain of the Doppler signal, which oversaturates the phase quadrature detector, the thing that determines the direction of the blood flow, or by scanning too close to 90 degrees. And when you get too close to 90 degrees, you can create spectral crosstalk through a process known as inherent spectral broadening. Okay, and so what inherent spectral broadening is, this is a unique artifact to transducers, to phased array transducers. And I'm going to just kind of draw it up here in the corner. If you have a transducer, okay, and we know that this transducer is going to send out along an incidation line our spectral Doppler signal, right? So there we go. And we have some blood flow coming to it. Well, we know that this spectral Doppler beam that is created has to be created through the use of several microcrystals, because it's phased array. That's how we do it. We utilize several microcrystals to create this beam that's going to come down and interrogate our artery. So let's just put an artery in there so that we've got something to interrogate. The artery is not important in this discussion, but the distance from the from this microcrystal here to the angle to this microcrystal and the angle to this microcrystal are slightly different. Okay, so these two angles are slightly different, and because these angles are different, you get different frequency shifts, because if you remember the frequency, the Doppler frequency is equal to, let's see, frequency Doppler, there we go, Doppler, is equal to 2 times the velocity times the fundamental frequency that we transmit with times the cosine theta, right? This is not drawing out as well as I had imagined it would when I wanted to do this. So cosine theta divided by the speed of sound. Right, so we've got different thetas for different parts of the sound beam, and that causes a broadening of the spectrum. So remember, this is your spectrum, how wide this this bandwidth is on this image. And so this causes a broadening of that and makes it, instead of having a nice clean window underneath here, it starts filling in with extra echoes because we're getting some velocity measurements in that area. And this is what inherent spectral broadening is, and it's important with phased array transducers. And the reason why I'm putting a lot of emphasis on this inherent spectral broadening is that back in the day, even before I started scanning, a lot of literature was written on how this filling in of the window in Doppler indicates disease. That's spectral broadening. And it does. It indicates a more tortuous flow of blood. But once they went from single crystal transducers to phased array transducers, this occurred anyhow. So you may see some literature that says that with spectral broadening, there's potentially a 40 to 60% chance, or 40 to 60% stenosis involved. And you can tell that because of spectral broadening. Well, no, you can't tell that because of spectral broadening anymore. Once we went to phased array transducers, that became part of this problem of inherent spectral broadening. And so that diagnostic criteria really no longer exists. So that's inherent spectral broadening. That can cause crosstalk. You can imagine if our transducer, I'm going to draw another transducer over here, if our beam coming off of this transducer is far too close to 90 degrees, okay, and you've got some angulation into the group that you're using for the measuring the spectral Doppler, you know, if the flow is traveling from right to left, okay, well, certainly at this, for this microcrystal on the right, the flow is away from it. For this microcrystal on the left, the flow is towards it, okay? So now we've got the situation where you've got flow toward and away from whatever you're measuring, and that's crosstalk. Okay, so that is crosstalk. How do we know it is not a mirror image artifact, as Dr. Edelman says? Well, there's no strong reflector between it and the actual structure. And it's not an image. It is a, so it can't be a mirror image. It's not a mirror image artifact because this is spectral analysis, not an image. This is a bunch of velocities. All right, moving on. Lobe artifacts. So lobe artifacts are grating lobes or side lobes. Side lobes occur only from single crystal transducers, which, you know, we haven't used since 1990. Grating lobes are common. They occur. There's several ways to minimize them. We'll talk about those another time. But these, again, violate the assumption that structures positioned in the beam's main axis, that reflections only come from structures along the beam's main axis. And this is showing you, so I want to point out this picture on the right here real quick. We see the main axis of the beam is the strongest portion of the signal, but grating lobes exist at various points lateral to that, and so if you have a reflector lateral to the main axis, it can cause a reflection. This image in the center here, again, you see the main axis beam coming off, and you see these grating lobes off to the sides. They're weaker than the main axis, so they're not going to cause as bright of an echo, but there's real energy in there, so yes, it can cause an echo to occur. So lobe artifacts, let's see if this is going to work. And you can kind of very faintly see on this image that's being repeated here, there's a lobe artifact coming off at an angle along this area here in this image. It's not the best demonstration I probably could have come up with. But anyhow, you see a little lobe artifact coming off to the side there. So side lobes arise from single crystal transducers. Grating lobes are created by array transducers. This causes a lateral displacement artifact. This is a beam going off in the wrong direction. The two ways we can reduce grating lobe artifacts is by subdicing. And so subdicing, let me go ahead and draw a picture here of what subdicing is. If we have a crystal and the microcrystals are cut into it, then subdicing is cutting into those microcrystals just a little bit, not all the way through. So subdicing reduces grating lobe artifacts, and then another technique which reduces grating lobe artifacts, is apodization. And apodization is where we utilize different voltages depending on which crystal we're hitting, and so each little subcrystal gets hit with a different voltage, and that's apodization, and that causes a reduction in side lobe, grating lobe artifacts. Refraction, one of our favorites. This is just simply a physics thing where sound changes its direction along a path. Like grating lobes and side lobes, this causes a lateral displacement artifact where things are moved to the side of where they should be. So a copy is side by side to an actual reflector. Again, same as grating lobe and side lobes, they are lateral displacement artifacts. Spatial resolution artifacts are errors that occur when two or more reflectors are displayed as one on the image because we simply don't have the resolution to resolve them. So spatial resolution artifacts are when the beam is wider than or thicker than the reflector. A slice thickness artifact is a type of spatial resolution artifact, and this is what we often will call a partial volume or section thickness artifact. This is where the elevational resolution is too large, and so reflectors that are either in front of or behind our transducer plane are displayed in the image itself, and this violates the assumption number 5 that an imaging plane is extremely thin. Some of you are probably wondering at this point, do I need to memorize the different assumptions? Is somebody going to ask me what is assumption number 5? Well, no, you don't have to know that quote number 5 is that the imaging plane is too thin, but you do have to know that a slice thickness artifact can be caused because the imaging plane is thicker than the reflectors. Okay, so you do have to understand the concept behind it without having to tell me what number of the 6 assumptions it is. So slice thickness artifacts, when we have very thin beams as seen on the left here, a structure within that beam is shown wholly as itself. When we have a thicker beam and a target is smaller than our beam, then the beam incorporates not only the target but tissue in front of and behind the target, and so these can cause objects to kind of disappear. And so as an example of that, we have 2 tubes in Phantoms here that are the same size, exactly the same size, but the beam at the depth of tube A is smaller than the beam thickness at tube B, and so tube B gets averaged in with the tissue in front of and behind it and becomes very difficult to see in this case. We can tell that it's there because we're seeing the strong reflector of the specular reflection on the edge of the tube that we see here on tube A, but we don't see the anechoic center of tube B because it's being averaged in with tissues in front of and behind it. So this is a slice thickness artifact. Here's another example of one. This is a slice thickness artifact that this is a radial artery, and we see it quite clearly in this image on the top, and then on the image, the next image over, we don't see it as well because the artery is being averaged in with the tissues in front of and behind it. An axial resolution artifact, again, this is one of our spatial resolution artifacts. Objects along the beam path are too close to resolve, and remember they have to be at least spatial pulse length divided by 2 apart, and so if they are that far apart, then we can see them as 2 separate objects, but if they are closer together than that, they blend together and form one object. With the lateral resolution, beam width and lateral resolution artifacts, again, if we have objects that are equally spaced apart and we're seeing this beam width is not the same at both locations, we'll end up with a final image, whereas dots 3 and 4 are blended together as one band and dots 1 and 2 are separated. So we have enough spatial resolution to separate dots 1 and 2, but not 3 and 4 in this example. Multipath artifacts are any artifact that's created when sound reflects to another structure instead of going directly back to the transducer. So it's very similar. It is a type of mirror image artifact. Reverberation is another type of multipath artifact. And so what we're seeing here is we're seeing a strong reflector in this blue structure here, and then it shows up as the beam comes directly to it, but some of the beam bounces off and hits another reflector over here, which then comes up and hits the transducer. And so along this path, this yellow path, you would see a continuation of the beam instead of, there we go, and then this structure here would then be displayed down here because the sound came along this path initially, and so the machine is going to make the assumption that when this tertiary echo comes back to the transducer, that it came back from directly along this path here. So this is a multipath artifact. And again, this shows you the reflection of the structure deep to a strong reflector. Again, that pretty much describes the mirror image artifact. There's another type of artifact that we see particularly in MSK imaging, and this is anisotropy on curved surfaces. So tendons and ligaments are very strongly reflective specular reflectors that have very fine fibular striations within them, and if you're not at 90 degrees to them, then the sound gets reflected off into another direction. And so anisotropy is the fact that the sound is coming down from our transducer and hits the highly reflective tendon and then bounces off into Never Never Land. And so this area appears to be a torn tendon when actually it's not. If we turn our transducer a little bit, then we can get strong reflections off of the specular surface, and they come directly back to our transducer and give us the reflections we were expecting. So we just have to angulate our transducer a little bit to get rid of anisotropic effects. It's important to know that with an anisotropic effect, heel toeing or angulation of the transducer can make the effect go away. But if it's a real tendon tear or a real diagnostic finding, it will not go away no matter how much you angulate your probe. Speed error artifacts, we did this in the lab. This is where sound propagates through tissue or medium at a speed other than 1540 meters per second and gives you an incorrect depth. And so we can often see this in tissues that are not soft tissues, such as a cyst or a silicon implant. Speed error artifacts can cause something known as range ambiguity. In this case, we can see a liver lesion that is cystic. It has enhancement behind it, and because it's cystic, we can make the assumption that inside of it is water. And so the water is traveling probably at a speed of 1480 meters per second. And so what happens is the sound goes behind it, and then when it gets in the water, it slows down, which causes the sound to be slower, reflected back to the transducer later than it does from other areas, and it causes a step-off artifact or a break in the distal structures to the cystic. So with speed errors, if the medium is slower than soft tissue, then the round trip time is too long and the system will place the reflector deeper than it should be. If the medium is faster than soft tissue, then the round trip time is shorter than it should be, and the system will place the reflector closer to the transducer than it should be. And so in the first case, the distances are overestimated, the depth is overestimated. In the second case, where it's faster, the depth is underestimated. Here's a couple of instances of speed image artifacts, and we can see with a saline breast implant that is, we have the saline breast implant here, and then you can see it is just sitting in an in vivo, in a petri dish basically, and we have some fluid next to it which is assumed to be saline too, and we end up with no difference in the speed, in vitro, excuse me. Yeah, in vivo is in the human, in vitro is in a dish. But when we put in silicone gel, we can see the difference in the speed of the flow. So we see that in this case it's moving much faster than in this case. Okay, so here is one that is in vivo, and this is a saline implant, and we see the pectoralis muscle behind the breast tissue that looks absolutely nice and smooth and intact, and on the right we see the step off because of the silicone gel implant causing a speed error artifact. Well, actually I think it steps up. There we go. So it steps up a little bit. Well, no, this is saying 970 meters per second, so it would be dropping down, and then I guess this is reverberation or hazing. Alright, so other types of range ambiguity artifacts. If you are imaging at a particularly short depth, let's say, and there's a strong reflector deeper than where you're imaging, so our depth is right here, and there's an object that is deeper than we are imaging, on the next round, so on the first time that the sound comes down and hits that, the reflection from this doesn't get back to the transducer until the next beam is sent out, and so the machine thinks that it's right up here close to the transducer. Okay, so these reflections from deep structures arrive with the next pulse and get interpreted as being very close to the transducer. So our newer state-of-the-art probes that utilize binary encoded transmission, or chirp transmission, or Golay coding, if you will, basically get rid of this type of artifact. Here is one that was found in the wild. This is a particular type of speed error artifact that occurred. One of my colleagues was scanning this uterus, and she said that the IUD that was present, and we can see the IUD, she said it was not in the endometrium because you can see the reflection of the IUD in front of the endometrium. This is in the myometrium. We're starting to see that reflection. So she said it was a misplaced IUD. But what she didn't realize was that this was a GE machine, and there's a particular artifact, speed error artifact, that is known with the GEs that occurs when there's a significant difference in the speed of one object, such as a metal IUD and soft tissue, that actually causes it to be placed on the image anterior to where it really should be. And so she turned this in as being a misplaced IUD, and we found a reference to the GE technical worksheet that said that this could happen, and included it with the examination so that the physician could then make the diagnosis whether it was in or out. Not every type of artifact is inherent to our machines. Some of them can be caused by other machines. So this is electrical interference that has occurred from a nearby operating room that is causing these artifacts to appear on our screen. And these weird looking artifacts like this is all from electrical interference. And it's often due to the use of these strong things, Bovie devices in operating rooms that cauterize tissue. The Bovie puts out such a strong signal, electromagnetic signal, that it can easily cause this artifact to occur. recently on examinations, the SPI examinations, they've liked to have started asking questions on what speckle is. Acoustic speckle, which we've often seen on ultrasound since the beginning of time, it just makes our tissues look very grainy, gives it a grainy appearance. But it turns out that, tissues don't have to be speckly, even ultrasound tissue. Speckle is an artifact that occurs due to destructive and constructive interference patterns from structures that are smaller than the wavelength of the sound. So if you have a very small wavelength of sound, you can end up with speckle. And speckle will then appear as grainy tissue-like textures. Compound imaging can reduce speckle, and then most machines today have speckle reduction technology that you can adjust in order to reduce speckle. And the reason they don't ship them with the speckle turned all the way up so that you don't see speckle is that people are used to the type of image with speckle in it and not used to images without speckle, and they think it looks wrong to their eye, and so they initially will start putting speckle back in order to make it look like an ultrasound. So anyhow, that's speckle. Speckle is the result of constructive and destructive interference from reflectors smaller than the sound beam. Harmonic imaging is a really nice technique which reduces image noise. It increases the signal to noise ratio. It narrows down your beam width and certainly improves lateral resolution. It can also improve axial resolution and elevational resolution. So it's a really good technique, but it doesn't always work. So how do you tell if harmonics is working correctly for you? You turn it on. If the picture got better, great. If it didn't, you turn it off and you say harmonics doesn't work. It's that simple. Color Doppler artifacts. This is when color appears when there is no flow. Other types of color Doppler artifacts is when there's no color, but there is flow. And then sometimes we have the wrong color demonstrated, and this occurs and it confuses the direction and velocity of the flow. In the case where there's no color where there is flow, color flow is very dependent on the intensity of the sound reaching an interface, and so one of the things that often can be done is to select a different frequency in order to improve the signal. So if things are deep, then you really want to drop your frequency in order to get enough sound down there and enough reflection back in order to create an intense enough signal in order to put that signal on the display. Other things you can do is reduce any kind of color filters that you may have turned on, adjust your gain, and adjust the threshold or priority for the color. A lack of color does not always mean there is no flow. So if you don't see color, that doesn't mean there is no flow. It's not a diagnostic criteria. Sometimes, though, we have color noise, color where there's no flow, but we're still getting color. So remember, anything can cause a Doppler shift. It doesn't have to be blood. It can be muscles moving, such as the heart, or anything else can give you artifactual color noise. One of the most common causes of artifactual color noise is movement of the transducer. Of course, we have to move our transducers in order to look through different windows, but small movements of the transducer can cause color noise also. We can utilize color wall filters to help decrease this noise, though in my experience it doesn't work that well. It may work in a situation where you have a clinical bruit, and that may be causing enough motion of the tissue in order to make it very difficult to see exactly what your imaging, because you get this tissue moving from this trill, and this vibration causes color bleeding. Last artifact that we're going to touch on here is aliasing, and this is the most complicated effect to understand. This is related to flow velocity and the pulse repetition frequency. Essentially, if the pulse repetition frequency is below the Nyquist limit, then aliasing occurs. This causes either the wrong color to appear, or it causes the flow to appear on the baseline in the wrong direction. If the velocity is just above the Nyquist limit, then the flow appears to be very slow, the dark in the other direction. And so color aliasing is a very complex, but it's easy to fix by just turning up the pulse repetition frequency. Alright, that concludes artifacts, and I hope you found that helpful.